Welcome back to Lip Service Lounge, and we are still continuing our discussion on total body care. The next segment we will be discussing oral care. This is very, very important. You have to maintain good oral hygiene on a daily basis. It is never acceptable to skip a day on oral hygiene. It's very important for a lot of reasons. Obvious ones, you don't want to have bad breath or offend anybody with bad oral hygiene, but it's very important just to maintain the health of your mouth. So I'm just going to share with you what my daily oral hygiene routine is. So I have a few products here, and I have a few of my favorites. You can use any products that work well for you or that you like, but these are my favorites. So the first thing that I do every day is floss. You can purchase floss for as little as 88 cents. This is what I purchased this for at Walmart. And floss is just string that has a wax coating on it. It's very important to floss because it removes the food that is trapped or lodged in between your teeth. That is another thing that causes odor or bad breath, rotting food in your teeth. So you have to make sure you get that out. If you don't get it out, you can run the risk of developing periodontal disease or gum disease, and there's studies that show that you can even develop heart disease from not flossing. So all you do is just take the string and wrap it around your finger, between your thumb and your forefinger there, and then make sure you get in between each tooth, covering the whole mouth. So once you have completed the flossing, the next thing you can do is rinse, because you want to get all of those particles out of your mouth. The next thing I use is a pre-rinse. I love Listerine's pre-rinse. It's a whitener, and it also helps again with restoring your teeth, the tooth enamel, and getting all of those things out of your mouth. I use this. You just take the top off and fill it up about a third of the way, and then you swish and gargle for about 60 seconds. Once you've completed your gargling, you can just spit that out and then proceed on to the next portion, which is brushing your teeth. Now, what I like to use is, this is a Colgate vibrating toothbrush. I like to use the vibrating toothbrush because I feel like I just get a deeper clean, a better clean when I use this toothbrush. So this toothbrush is battery operated. Has a little button on the front. You just push and the motor comes on. So what I do daily is just wet my toothbrush. And I always use warm water when brushing my teeth. Another product I like to use daily is baking soda. So you just take the baking soda, open it up, pour a little into your hand, wet the toothbrush, dip your toothbrush into the baking soda to make sure it's coated or covered. And then after you do that, you take your toothpaste. One of my favorite toothpaste is Arm & Hammer. They make different varieties, and I like to alternate between the varieties. They're all great. But I take the toothpaste and then spread the toothpaste over the top of the baking soda. And then I just thoroughly and carefully brush all of my teeth. After I brush the surface, the front and the back, I then brush the gums just to condition the gums. And then I finish by brushing my tongue. After I do all of that, I rinse again with warm water. Once I'm complete with the brushing, before I do my final rinse, I use this product called a tongue scraper. This one is by Oral Brush. This is probably my most favorite product for oral hygiene. Most of the bad breath is caused by bacteria that's left in your mouth. And most of that bacteria resides on your tongue. Notice in the morning when you get up, you'll have a thick white film on your tongue. And you can remove that with a tongue scraper. So after you brushed your tongue, rinsed out, then you can use your tongue scraper. You are in control of the tongue scraper, so don't be nervous about it. You won't choke, but you try to go as far back as you can and scrape all of the white film that's on your tongue off. Rinse and then scrape again. This really leaves your mouth feeling fresh, and it prevents or probably eliminates about 90% of the germs and bacteria that cause bad breath. And then I finish up with my Listerine rinse. And Listerine makes a variety of, flavors, but they've come out with a product that's called Listerine Zero. It doesn't contain alcohol. so you can swish with it for a good little while without it burning. And this is the final thing that I do. So that is my complete oral hygiene care every day. So this is something that you want to do every morning, and brushing after each meal if you can. If you're not able to do that, at least carry your floss with you so you can floss after every meal and remove those food particles. And then this is another product that's called brush picks. I love them. They are like little toothpicks. And I don't think one, oh, okay, so I'm able to get one out. And they have two different ends. One is just like a flat end, and the other one is like a little brush. You just simply go in between your teeth and it removes the food particles from your teeth. Floss or brush picks you can carry easily in your purse. So I recommend that you keep those on hand as well. Now, if you live in a household where there are not a lot of space in the bathroom for your toothbrushes, meaning there may not be a drawer for you to put them in, I highly recommend, particularly if you have a bathroom that doesn't have a separate space or a closed space for the toilet, to keep your toothbrush after you've used it into a toothbrush holder. That prevents the bacteria that's floating around in the room, and particularly after you flush, water kind of comes up, water particles come up in the air, and they can land on any surface in the bathroom, and your toothbrush can fall victim to that. So make sure to keep your toothbrush either put in a drawer or in a toothbrush holder if you can. So that's all I have on oral hygiene. Again, it's never acceptable not to cleanse your mouth on a daily basis. It's good to practice this and make it a habit, a way of life, and just to ensure that when you go to the dentist's office that you have a good visit. It keeps your gums healthy and your teeth healthy as well. So that's all I have on oral care. Stay tuned for part 3 where we'll be discussing total body care.